Welcome back to the Thom Hartmann Program. I'm Alex Lawson, filling in for Tom. I'm joined in studio by Dr. Sanjeev Sriram, a.k.a. Dr. America. And we're going to go right to the phones here. And we'll go to Gail in California. Gail, you're on the line.
Hi, good morning. I wanted to just say to you really briefly that Tom had someone on last week who was talking about an Excel spreadsheet that I looked up online with all the different pharmaceutical companies and how much they pay in to basically to lobby for their organizations and the drug companies. And I used to be a medical device sales rep for many years. They train us to talk to physicians and doctors and pharmacists like an equivalent. I mean, we were trained amazingly well, and to speak to them as effectively as possible. After being laid off and having my sister still in pharmaceutical sales, they put so much money into their sales force and also the lobbying efforts in order to control the pricing on our drugs, so that after I was laid off, I didn't have insurance. I didn't have a big company that I was working for, a big drug company. And my inhaler price went up to $410 per vial. Then with the ACA, I was able to get insurance again. But my pre-existing condition, of course, was asthma. But now with my Affordable Care Act, Obamacare, it's $15 a vial for the same exact non-generic product. So we have a big problem here. I mean, the cash price is still $400. That's ridiculous.
Mm-hmm.
So I just want to know what your thoughts are on this, and I don't know how we can get around regulating, basically, the pharmaceutical and medical device organizations, because they spend so much money to get the votes they want.
Yeah.
Gail, thank you so much for your call. Sanjeev?
Yeah, and, actually she, she's bringing up some great issues. And luckily for patients and families like Gail, Senator Al Franken has introduced legislation, and I think that there's something about 20 senators have co-sponsored the legislation.
16 other senators.
Right, 16 other senators in the Senate side, and then I think there's other sponsors in the House. What's great about this legislation is that it's going
Which
after...
just pause on there, because you've done this a long time, so have I. I've never seen that many members, right? I mean, that is a lot on a very comprehensive bill. It's a big bill.
Right. And I mean, and this is a big bill that is going after the worst behavior in the drug companies. So one of the things that I think it's one of the first sections of this new legislation is really targeting for transparency. So they are going to require the drug companies to report just how much money are they spending on marketing versus R&D versus lobbying. Like, they want to see, they really are auditing, for lack of a better term, just where the money is going with these big drug companies and corporations, which to me, it's sort of like, if you're not following that money, then, it's...
Well, to me, it's like, how are we not doing that already?
Right?
I think most people would be shocked to find out that you can't actually get that information.
Right.
Which is why the drug companies get away with just lying to the people.
Right.
And they say, oh, well, we have to charge these high prices. High prices are the cost of innovation.
And what's great is that
that's the big lie.
They're taking a step up on this, where they're going to actually make that information public. So there are a few states that have tried to require companies and corporations to hand over this information about how much money they're spending on all of these behaviors. But then that information is not always made public. With Senator Franken's legislation, it goes public.
So I like transparency, but I want to just say it's not nearly enough for me.
Oh, right.
And I don't think it's enough for you.
Right.
But I'm going to tell you, we have this conversation often, so Sanjeev already knows. But, I don't come to this through politics. I come to this because after college, I worked in an outreach HIV clinic in Chicago, and I learned that, like, true evil could be seen in these pharmaceutical companies.
Right.
That their profit model included misery and death around the world and here at home, that they made money by withholding what people need to stay alive or to live a life of dignity, or just to have the drugs that their doctors say they need.
Right.
And so I am extremely radical on this because Franken's bill, it's great. It's comprehensive in its own way, but it doesn't even go a tenth of the way for me because transparency, it does have drug importation, so from Canada, which people should think about. These are the same drugs, the same exact drug in Canada. There's one called Xtandi. It's for non-operable prostate cancer, $130,000 here. Exact same drug produced in the exact same facility, $30,000 in Canada.
Right.
The only thing underlying it is greed.
Yeah.
So like I like that. I like the transparency. I love the importation. I love the Medicare negotiation.
Yeah, and when it comes to, they're no longer going to be able to do a tax deduction for direct to consumer marketing, which
again is great. But you know what? I'll state here. I love the Franken bill. And our organization, Social Security Works, we've endorsed it. We're pushing it hard. We will be working this. It will do great things for people, for real people.
Right.
Their drug prices will go down because of this. I want the takeaway of this is people should understand the Franken bill will lower people's drug prices. Both through the Medicare Part D negotiation and the importation. Both of those are active levers to lower prices.
Right.
The other parts, it's kind of like two-step or three-step. But those are active levers to lower. But I will say, we should be at the point where we're talking about compulsory licenses.
Oh, sure.
And I know me and you don't disagree on this. But I mean, like, these companies are so wrong. They should lose the privilege of the patents that are giving them the power to charge people astronomical rates. That's where we need to be.
And I mean, and I think you're absolutely right that there have to be these kinds of consequences and punishments that hurt. They can't just be the slaps on the wrist anymore. We know that that doesn't do anything.
Because let's go into the slap on the wrist. The slap on the wrist is monetary fines, right? So if the monetary fine is less than the profits that you make by the behavior that is fined, it is not even a slap on the wrist. It is a business decision where you just you have your actuaries, they cost it out, and they say no. You know what? And that's what I learned in when I learned my hatred of pharma. That those decisions are made, that they calculate costs of lives, they calculate the cost of hurting people, right? So they put drugs on the market that they know are unsafe because they calculate the lawsuit costs and everything. And they come to an answer. And they say, oh, well, go ahead. The math people say it's good. That's why what we need on the other side of the hopper, to me, and the Franken bill is a great step. But
I look at it as like that. I think it's a great starting place. I think it's a good foundation on which you could build more. And I applaud it for coming at the time that it comes, where I feel that, it's great that we defeated Trumpcare, but we need to keep pushing things forward.
That's a great point.
And I think that this was, and this is the right way to go, where you show that, this is what real leadership in healthcare looks like. And if you really want to draw that contrast between Trumpcare and Senator Franken's bill, is that there's no doubt or question that, that Senator Franken was thinking about patients when he wrote this. That it is very obvious how patients are going to benefit, how their pocketbooks and their stress levels are going to benefit from actually holding pharma's feet to the fire. And I hope that, patients like Gail and her family are able to, reap some of the benefits from policies like this. But what we really need to do now is that we have leadership on this kind of legislation. And now we need to put the pressure up, where during the recess, it's a great time to visit town halls and go back to those district offices and become a regular. Become that nagging regular until this becomes official.
So Senator Franken's bill in the Senate, and then Representative Jan Schakowsky in the House is taking the lead on the companion bill in the House. And so if people are going to their town halls, they can say, get on the bill to lower drug prices. Senator Franken in the Senate and Representative Jan Schakowsky in the House. Let's go to another caller here. Paul on WCPT, which is a fantastic radio station. Paul, you're on the line.
Yeah, thanks. A couple things about pharmaceutical costs I've heard mentioned. For instance, the R&D costs. There's something we have to consider here. First of all, much of the basic R&D, the pharmaceutical companies are able to glean from universities. It's stuff that's what we fund. But the other thing is the way they actually figure their R&D costs is this. Let's say they take $50 million to research a drug, and it takes them 5 years. They $50 million over 5 years. They don't say, oh, it cost us $50 million we have to make up. The way they figure it is, how much would we have made with $50 million had we invested it in the market? And that's how much it cost us.
And you want to know another thing, Paul? What they really love to do? What they really love to do is they give out free samples and they go and talk to doctors over dinner and golf outings, all of that. Yeah. And they actually, it's market research, it's advertising, but they actually count it as research.
Right.
I mean, think of how crazy that is.
I mean, and this speaks directly to my I first encounters, if you want to call them that, with Big Pharma and just how problematic they were. When I was a resident, I did a small health policy rotation as an aide for then Congressman Waxman. And we were doing some research on, I think, one of the issues that was coming up with Pharma, but it required me to go back to the time of Vioxx and all the problems that there used to be with that drug. And what you quickly realize when you're going through, when they inundate the congressional offices, whenever they get subpoenaed for documentation, their answer is that, well, we will give you, truckloads and truckloads of paper, you drown in the paper, and we probably won't hear from you. And then they're not counting on guys like me who want to show up at their congressman's office and help out. And I can quickly get through some of this paper. But what the paper teaches you is that there is really no lines between misinformation, marketing, and misery, that it's all just kind of mixed in there together. And what Gail was talking about before, about how well-trained, the reps are, is that, even if you are one of those doctors who goes to this dinner for the purpose of demanding some answers because you're curious, because you want to question the science, if you will, these guys see that doctor coming. And they know how to redirect the conversation to a marketing ploy, and it no longer is about educating these physicians.
We don't have too much time. I'd love and come back and we'll keep talking about this. But let me share one with you that is like another. Just you're in a bind. Yeah, I've worked at 2 HIV clinics, and HIV is a very complicated drug. The pharmaceutical treatment is very complicated. There is resistance that forms, and so there has to be new innovations all the time. So you literally have to be at the cutting edge of knowledge for your clients. So for clients who have resistance, this is a life or death issue. Well, guess what? The only people who have that data and that information are pharmaceutical companies. Right. They are the only ones who have it. Right. So you have to let them into your clinic where they give away free lunches and they give you the PowerPoints, and you have to be watching this, doctors, nurses, paraprofessionals, and you have to know, you're like, okay, this is the only way I'm going to learn about this, but they're selling me. So I can't trust it as neutral. Yeah. I mean, like, that is a ridiculous way to do medicine.
Right. And it's to always be second guessing of, okay, how much of this is really a benefit to my patient, and how much of this is really just is just the right amount of exaggeration to make it good marketing. And that is a terrible place to be in as a healthcare provider, to not be able to answer the question directly. How does this help my patient?
And it's also not how science works, right? And so we know how it should be done. Right. All studies should be public, right? You shouldn't be able to throw bad studies down the memory hole. Right. So you're always asking, what am I not seeing here? Yeah. I'm seeing what they want me to see, but what am I not seeing? Yeah. This is my point of view. All the research should be publicly funded, and it should be publicly held. It should be publicly available. Yeah. And then you could be solidly confident that you're standing on science. Right. But I mean, that is... It's not only not what we have right now. We literally have the opposite of that.
Yeah.
Where you have these enormous financial incentives for them to convince people. And in the last minute here, Dr. America, where can people go to find out more about what you do and also to take action on drug prices, on the attacks on Medicaid and everything?
Yeah. So my podcasts are on iTunes. If you Google Dr. America Sanjeev Sriram, it's one of the first links that pops up. You can follow me on Twitter. I'm paying close attention to these issues. My Twitter handle is DRSRIRAM, Dr. Sriram. And I'm writing on the Huffington Post about these issues pretty frequently. And on April 22nd, there's going to be the March for Science. And it's, I mean, as much as climate change is going to be the central theme of that march, I think it's a great time to, bring scientists out into the, the public and, celebrate, the process, the hard work processes of science.
So the last caller said that they gleaned it from, which isn't totally true. What they do is they take it wholesale.
Yeah.
Right? These are university publicly funded. That is the science.
Yeah.
And we should celebrate the science. And in my point of view, we shouldn't just give it wholesale to the pharmaceutical companies. Dr. Sanjeev Sriram, Dr. America, thank you so much for joining us on the Thom
glad to be
Hartmann
here.
Program.
Thank you.
You're listening to the Thom Hartmann Program. We'll be right back after this.